Hi, welcome back to Rohrich Nose Podcast. This is Rod Rohrich from Dallas, Texas. I'm a board-certified plastic surgeon and a rhinoplasty expert, and helping you become a better you. I just want to share with you one of the most commonly asked questions in my consultations for patients that want a nose job or a rhinoplasty is that they say, Dr. Rohrich, will you break my nose? So I'm going to share with you when and why I do that. And most often I say I will, if it needs to be, gently manipulated, and there are nasal bones. And will I break my nose? And the answer to that in most cases is yes. But it truly depends on the patient's size of their nose, and whether it's a primary or a secondary rhinoplasty. But the key is you want to make the nose in proportion to their face. So if they have a wide nose, as you see in this patient, of course you're going to need to bring the nasal bones together. And really the only way to do that is with precision osteotomies. And you can do that in a very controlled manner, as you can see in this patient that has a really wide nose, wide dorsum, and of course you have to bring the nasal bones gently together. And I think that's very important. So how do you do that? Well, you have to analyze the patient. You have to be very precise in how you do it, and you have to have maximal control. And the goal in rhinoplasty is to form those nice, beautiful dorsal aesthetic lines that you see when you look at yourself in the morning. And then on the side view, you want to make sure your dorsum is straight. And often the way you have to accomplish that is by breaking the nasal bones. And it's not just the nasal bones that need to be narrowed, it's also the cartilage in those areas. And did you know that there's at least 5 nasal bones in the area of the nasal pyramid? You know, it's not just the paired nasal bones, it's the maxillary process on either side and the frontal process all make up what's called the nasal pyramid. And I think that's important. And that's pretty strong part of the nose. And the nose is unique because you have a bony pyramid here, and then you have a very mobile part to the distal part of the nose. It's a very unique aspect of the human face, and it's also both functional and aesthetic because you need it to breathe through your nose, and that's really important. So do you really need to break your nose and do osteotomies? Now, breaking your nasal bones is much different than having a nasal fracture, because that is usually uncontrolled and it can be traumatic and can hurt. And when you do controlled osteotomies, as I do in rhinoplasty, it is very, very seamless and really does not have any discomfort usually as part of a rhinoplasty, and it doesn't bleed if it's done correctly, because you can do it in a controlled manner. And that's really what I mean by that. And how do you do that? Well, you take a little sharp chisel, it's called an osteotome, and you go in at an entrance level on the side of the nose, as you can see here, and then you precisely do a digital hammer tap, and you can actually then feel that bone gently in fracture. And I'm just going to show you how you can do that. You know, you stay low and you go right at the orbital rim and you just gently bring it in. And you can actually see that when I'm doing this in this patient. And really what you want to do is you really want to control this in a very methodical manner. And when you do that, you can truly get an excellent result. And the key is you have to use sharp instruments like this osteotome and a little hammer, it's called a mallet, and then you have them say tap, tap, and notice on my thumb on my right finger, you can actually see exactly what I'm doing. And at the moment that I feel it's going to be in fracturing, I'm going to stop. And so you tap, tap, you bring it in, and then you're actually fracturing it in a low-to-low manner. And it really gives you the power of doing that, and you do that on the other side as well, and then you bring the nose in and you can actually soften it. So that's very important to do. It's controlled, there's no bleeding in that area, it's very precise, and that's exactly what you want. And even in patients that have narrow nasal bones, like this gentleman, but they're a little deviated, you still have to take down and reshape his nasal pyramid because he's got a big bump on his nose. So you want to, when you take the bump on the nose down, it gets wider. So you still have to break the nasal bones. And that's really what you're doing in these patients. So you're gently bringing it in, and look how more natural it looks. And the nose is now straight, the tip is shaped, and it really looks good. And that's really what you want. So again, breaking the nasal bones is very, very atraumatic if done correctly in a controlled fashion, and that's really what you see in this patient. So, the goal is you want to do things that make the nose look natural, and breaking the nasal bones or the nasal pyramid is really part and parcel of a rhinoplasty in most cases. And it allows that patient to look good and look youthful and not look different. And the answer is yes, we are breaking the nasal bones, but we're doing it in a very controlled manner. And I think that's really the most important thing. And all of this is about predictability. As a rhinoplasty expert, these are all things that I share with the patient about the procedure, the technique. And when you do osteotomies, as we call them, precision nasal osteotomies, or breaking the nasal bones, you can do this in a very seamless manner that can be almost pain-free as part of a rhinoplasty, but it gives you the ability to get predictable results, which is what you want. And rhinoplasty is the hardest operation we do in all of plastic surgery. So it's a surgery of millimeters. It's a surgery of precision, reproducibility, and it has to be done in a very methodical way. And when you do it in this methodical way, breaking the nasal bones is an essential part and parcel of rhinoplasty. So when people ask me, will I break their nasal bones? The answer in most cases is yes, but it will be done very precisely, very non-traumatically, and it'll be part of what I call their natural look rhinoplasty, and that's really what you want. You want a natural look rhinoplasty that looks great and is natural and will last a long time. And I think that's really part and parcel of what we want to do in rhinoplasty today. And it's really modern rhinoplasty. It's predictable, it's reproducible, it's consistent, and it's done in a traumatic way. So in answering your questions that I see and hear all the time, will I break your nasal bones? The short answer is depends, but the long answer, as I've talked about, is yes, in most cases, I will break your nasal bones, but with the added benefit of actually making your nose match your face, and that's really what it's all about. Making not only match your face, but having a nose that not only breathes better, but looks better. So hopefully this has been helpful. Please give me your comments and thoughts on Rohrich Knows podcast about any aspect of rhinoplasty or anything in plastic surgery, because I strongly feel that an educated you is a stronger and more informed you, and then you can be your best advocate for health care that you desire. So again, thank you for joining me, and if you have any questions, please don't hesitate to reach out to me. It's either on my website or you can leave a comment on any of my podcasts on YouTube. Thank you.